What is happening? Man, it has been a minute since I've had a chance to get on to the Facebooks and the YouTubes here and talk a little bit about the EMS stuff. I've been posting pretty regularly in Instagram and Facebook and all, but I know I've said this before, man, I am in the move of my life and it is taking me way longer than what I wanted to. Um if you ever sold a house, you know what a craziness that can be. But with that said, I wanted to get on here, talk about a little bit about vasculature issues that patients can experience, other than the issues with their tanks, the inner tank of the body, right? The pipes and everything that makes everything work. Um, without obvious things like blood loss and trauma. Some things that you should be thinking about when you're assessing your patients and when you're taking exams, so that if you've got a clinical clue in an exam scenario, you don't run past it. Okay, if there's like a clue there that you need to be picking up on. Okay, now if you like this stuff, guys, do me a favor. Hit that like button, hit the little hearty button, the squeezy heart button, whatever. Even give me a thumbs down if you hate my guts. All right. And check out turbomedic.com for more stuff like this, videos, downloads, practice exams, everything to help you be a better EMS professional. Now, let me get into it here. I covered two other things in a previous video about a week or so ago. I want to get and do another one today and cover two more things that I think we see a lot in EMS and that you need to be taking a little more attention to. One is those patients with the high blood pressure, right? The hypertensive emergency. And this is that sudden rise in blood pressure. It can happen over just a few minutes. It could be happening over a few hours. The patient might have a real quick onset depending of a headache. Maybe even you might have seen the nosebleed, right? The epistaxis that goes on. They might even tell you they have ringing in their ears. All right. Their pulse normally and something like this will be strong. It'll be bounding, and or the patient blood pressure is going to be very high. Okay. The thing with something like this, not a lot we can do in the field, especially at the EMT level. Paramedics, depending upon guidelines, things like that, there's things that they can do. But you want to put that patient in a position of comfort. Try to keep their head elevated. Maintain their oxygen, of course, like you do every patient, and attempt to stop the nose bleeding. Guys, this is something, if you've been in EMS for a while, you can even put this in the comments if you want to tell me your quick experience. But trying to get a patient to pinch their nose, right? You give them a gauze and you tell them to pinch their nose and have them lean forward. It is oftentimes quite the effort because they have this desire, right? This pulling desire to blow their nose, to sniffle, right? They can't help themselves. It's just to think about it. Think about if your nose is bleeding, you have something in your nose, just your nose is running, right? You got this sensation, you have to do it. It's almost like sort of like an uncontrollable urge to either blow your nose or to sniffle. Try to tell the patients not to do this, right? Control that bleeding, pinch the nose at the base, and tell them to lean forward a little bit. Okay. That's one of the big things we can do as far as hypertensive emergencies. And again, certain guidelines, some protocols can let you do other things, but basically, position of comfort, head elevated, maintain their oxygen, and don't let them blow their nose. Okay. Now, the next one, which is more critical and also one that you see a lot nowadays because it is kind of popular. There are protocols getting thrown in place for this. There's more and more treatment modalities that are going out there for this type of thing. It is severe infection. otherwise known as sepsis, right? Guys, just making sense to you, hit that like button so I know you're watching and make it, stuff is making a little sense. Leave me a quick comment below as well. I want to know that you're watching this and you're engaged with me, guys. So, thinking about sepsis, this is that toxins, right? The toxins that are from bacteria. And this is causing your vasculature, the patient's vasculature, to leak fluids into surrounding tissue, that third spacing you might have heard about. All right. Now, patients a lot of times might have those signs of infection: fever, nausea, vomiting, diarrhea, right? They might have you when you do your assessment, you're asking questions. Maybe they're going to tell you, or family will tell you that they haven't been taking a lot of oral fluids, right? Haven't been drinking a lot of water. They might be hypotensive, but they're also going to be tachycardic and be having signs of that shock, right? They might be tachycardic, and they might also be a little, breathing fast as well, tachypnic. Okay. Now, skin on these patients, as opposed to what you might see with someone losing a lot of blood, where they become too cool, pale, diaphoretic. With the sepsis patients, a lot of times they're going to be hot and dry and pale, right? So it's a little difference there. So keep in mind when you're trying to figure out what's going on with patients, is to think about recent histories of infection. Okay, you might find out they had a recent pneumonia thing going on, right? They might have had a recent surgery going on, especially if they're a little older, right? Older patients. Keep this stuff in mind. Think about the entire picture. The fact that someone just has nausea, vomiting, diarrhea, that in and of itself might not be this great emergency why we got called there. But then when you get there and you start asking questions, doing your patient assessment, your patient interviews, you start seeing other things that might lead you along the line of them having a severe infection. Now, some protocols these days are going to have guidelines for you to measure the sepsis, right? This the scoring of that. Okay, there's ways to do it between your blood pressure, and the heart rate, and how you kind of do a little bit of math there and figure that out, plus the patient's mental status, all of that. Okay, so I don't want to go into it. I don't want you getting confused, because sometimes some protocols and some systems don't do that right now, but many do. So if yours does, know your scaling, know the stroke scale. I'm sorry, the sepsis scale, to figure out what it is, where your patient fits. Because a lot of times in certain evaluations with that, you'll have to go ahead and give a notification to the hospital and let them know that you're coming in with a sepsis patient. Okay, hospitals take the sepsis patients very seriously nowadays, much more than they used to do in the past. And we as EMS providers have become quite the vital sort of link when it comes to identifying sepsis in the field and getting the patient on a sepsis care plan much, much faster. At the paramedic level now, there's a lot of things with fluid and things like that. Even some paramedic systems and EMS systems let medics test lactic acid on patients. It depends upon where you work, right? But in this case, I just want to let you know just some of the minor little things that you can keep an eye out for when you get these patients and when you see these types of questions and clinical scenarios on exams that can help you. All right. And again, like I say, treatment on these patients, EMT level, not a lot you're doing. You put them in supine position. You're monitoring their vital signs, monitoring them for difficulty breathing. Okay. If they're in shock, of course, you want to go ahead and avoid that temperature loss. You want to go ahead and give them oxygen if they need it. At the paramedic level, there's things that we can do as well, depending upon your guidelines and protocols. But the main thing that I want you to take away from this, guys, is to keep an eye out for potential of the patient having a severe infection. Okay, because this is the thing that you might see on exams. More than likely you will these days, since it is kind of popular. And it's going to be the type of thing where you're going to have that clinical mindset of what you're supposed to be doing for patients that have a severe infection. All right, guys, I'm going to end it there. Going a little longer than I wanted to today, but listen, you like this stuff, please do me a favor. Hit that like button for me. Let me know you like it. Comment below and go check out turbomedic.com and get more content to help you be better at EMS. Guys, as always, I'm Jim Hoffman from TurboMedic.com. Stay safe.